And upper GI bleed is typically an umbrella term we use to include a bunch of different disorders, specifically peptic ulcer disease, Mallory-Weiss tear, tumor malignancy, an AV malformation, varices. The important thing you want to take away from this is if you are concerned about an upper GI bleed, ask about anticoagulants, antiplatelet medications, history of alcohol use, and any underlying liver disease or coagulopathy. Signs and symptoms, the patient's going to present with abdominal pain, coffee ground, hematoemesis. They may also present with frank blood in the stool or dark and tarry maroon stool. Now, tachycardia makes sense. That's a good compensatory mechanism that the patient is responding adequately because remember, stroke volume, cardiac output, heart rate, those are all interrelated. If the patient is hypotensive, then that suggests life-threatening blood loss. So typically, I see this mistake commonly. Please hold the blood pressure medications if you're worried about somebody with an upper GI bleed. The treatment for upper GI bleed is very straightforward. You give the patient volume, specifically blood. So in the real world, you're going to give the patient blood. If it's taking forever and you need to give them some crystalloid fluids, fine. But honestly, go and hunt down the blood bank and get the blood and take it there yourself and give the blood to the patient. Now, the exam answer is going to be if you're waiting for the blood and you're hanging around, go ahead and give them crystalloid fluids. Lactated ringer is fine, normal saline is fine if the patient's hypotensive. You're going to transfuse these patients if the hemoglobin is less than 7 or if there's a 2-point hemoglobin drop. So if their baseline's 10 and they present with 8, okay? The reason you want to get 2 peripheral IVs, 18 gauge or higher, and you can see there's a little example here of these different gauges. So 18, 16, and 14, you want a bigger diameter. That way you can get the blood product in faster. Okay. If you need review on Poiseuille's law, I'll just link the video up in the right corner in the description as well. Now, you want to give the patient IV PPI. Go ahead and get your gastroenterology friends on board. If you know or you have a suspicion that there's a variceal bleed or a history of cirrhosis, cover with octreotide, the somatostatin analog, and ceftriaxone. Okay. If there's hemodynamic instability or you're like, where's this source coming from? It's totally reasonable to get a CT angio, consult your general surgery friends, interventional radiology. The patient may need an enteroscope, colonoscopy, all those sorts of things, okay? So big picture for treating GI bleed is give the patient blood, okay? Now, that's it for today, guys. If you liked this review, this video, please like and subscribe. I'm super excited for some more exciting content coming up. And thank you so much for your time.